So, good morning, and thank you for everyone who could make it today. My presentation focuses on the impact of industrial agriculture on the environment and farm workers' health. Sorry, I just got a pop-up. Okay. Acknowledgements. I'd like to give a special thanks to Dr. Dawn Beeler and Kelsey Donnellan, who's an alumni from the INDS program. This project would not have been possible without them. A very special thanks to Ms. Carrie Sauter, who's the best advisor I've ever had and also the assistant director of the INDS program. And a special thanks to INDS staff and faculty for their continued support and encouragement throughout this time. I'd like for everyone to take a second and think about how our food is produced. Our current model of production is called industrial agriculture, which focuses on mass production of a few varieties, which also require use of pesticides, herbicides, and fertilizers. I'm hoping everybody had a nutritious breakfast today. Looking at the picture, how many of us would guess that everything here is healthy or produced for human consumption? Is our food safe? Many of us have heard an apple a day keeps the doctor away. Unfortunately, this is not true. Apples are considered to have the highest pesticide residue compared to other fruits. Research conducted from the USDA in 2011 found that 85% of foods had pesticides residue. One strawberry that was tested came back to have the residue of over 20 different synthetic chemicals, including pesticides and herbicides. The focus of my research project was to explore how industrial agriculture became in the United States and to understand the politics and the economics behind the development of industrial agriculture, as well as focusing on how these new practices would affect the environment and public health. And a special component which I thought would be really important to address was the risk associated for farm workers' health. The disciplinary perspectives involved in my project were environmental science, which was used to understand the natural and anthropogenic practices related to agriculture and how they would affect the environment. Health science was used to understand how adverse health is developed from certain industrial practices associated with agriculture. Political science was used to understand how policies associated with agriculture would incentivize or discourage certain agricultural practices. All three of these disciplines came together to provide evidence as to why some practices should be encouraged or discouraged because the effects that they would have on the other. The goal was to encourage safe practices which would result in improved environmental and public health. The current state of the debate, according to research from Johns Hopkins Center for a Livable Future, agriculture is the biggest contributor to climate change in the United States. They suggest moving towards regenerative agriculture and away from industrial agriculture as a way to limit pollution and conserve resources because industrial agriculture needs excessive use of synthetic chemicals, water, and fossil fuels. The research suggests that intensive inputs required by industrial agriculture are not sustainable and will bring us closer to the planet's inability to produce food and fiber for everyone. Now to explore the environmental considerations and to understand how harmful industrial agriculture is to our health and the environment. This picture on the right is the chemical formula for glyphosate, which belongs to a family of chemicals called organophosphates, which were previously used in chemical warfare as nerve gas because they target and damage the nervous system. This is why they are so effective in agriculture and are used to kill weeds and pesticides. Now, if we stop for a minute and think about it, our food is being sprayed with nerve gas, which is intended to be used as a poison. Alongside with that, glyphosate has other health effects and environmental effects. Chelation of the soil refers to a compound's ability to bond with certain nutrients. In this case, the application of glyphosate on plants results in chelation of the soil. So minerals which are present in the soil, such as calcium, iron, magnesium, manganese, nickel, and zinc, become attached to these glyphosate molecules, and they're unable to be absorbed by the plant. This means that plants are not as nutritious as they would have been without the application of glyphosate, because they're unable to absorb the nutrients. And all of these nutrients that I mentioned are essential for human health. And as an example, magnesium is responsible for over 300 functions in the human body. Glyphosate is also responsible for destroying the soil microbiome. The soil microbiome refers to the community of microorganisms who live in the soil and are responsible for helping plants to increase their nutrient content and to be more disease resilient. This happens because glyphosate also functions as a broad-spectrum antibiotic, which should be used with caution, but it is the most widely used herbicide. The company that produces glyphosate was created by Monsanto, and it is currently being sued for allegations that it causes cancer. Thousands of people are suing because the chemical caused them to develop non-Hodgkin's lymphoma, a cancer of the white blood cells. As of last year, 2020, Monsanto is due to pay $10 billion in cancer settlements. Because the chemicals used in agriculture are so harmful, there is a push to limit their use. The EPA and the USDA recommend using the following interventions as methods that can be adopted by farmers to decrease the use of chemical products. So in these pictures, the first one is no-till farming, which refers to leaving crop residue from previous years to preserve soil, to improve soil health, which will thus require less fertilizer. In the second picture, we see cover crops, which is kind of similar to no-till farming, but you plant smaller crops or plants with your crops so you can build soil health, replenish the soil with nutrients, help with erosion, and weed reduction. Riparian buffers pictured on the right are grasses, shrubs, or trees planted alongside farms to catch runoff, which would pollute aquatic environments. No-till farming and planting cover crops significantly decrease the need for the use of fertilizers, pesticides, and herbicides by allowing the soil to develop and maintain its health, nutrient profile, and biodiversity. Now we will be transitioning into understanding the working conditions for farm workers in the United States. Imagine having to work with chemicals so toxic that they are banned in other countries. While working, you would have limited to no access to personal protective equipment. Your pay would be nothing near the federal minimum wage, and you would have an annual income between $15,000 and $17,000 US per year. Unfortunately, these are the working conditions for 3 million people in the United States. Along with these dreadful working conditions, the current practices involved in industrial agriculture further harm farm workers, consumers, and the environment. Growing unrest among farm workers led to the strike in pursuit of fair working conditions, fair pay, medical insurance, and sick leave. In 1938, the United States passed the Fair Labor Standard Act, also known as FLSA, which would provide a working age minimum of 16 years old and a 40-hour work week. Unfortunately, farm workers were left out of these provisions. 22 years after the FLSA was passed, in the year 1965, grape farm workers in Delano, California would start a strike which lasted for 5 years between 1965 and 1970. The goal of the strike was for farm workers to have the same rights and protections as other workers in the United States. The strike soon turned into a boycott, which encouraged consumers to join and participate in the efforts to support the farm workers in getting better working conditions. The combined efforts of 3 main leaders, Cesar Chavez, Dolores Huerta, and Philip Vera Cruz, would result in the creation of the United Farm Workers Union. In his most famous speech, Cesar Chavez says, "Farm workers are society's canaries. They are exposed to multiple, possibly toxic chemicals with little to no access to medical care. Policy and regulation play a key role in workers' rights and protections. Three main governmental agencies involved in agricultural policy are the EPA, which focuses on ensuring the protection of water and air. In regards to agriculture, they monitor and restrict the use of chemicals. They also monitor point and non-point source pollution from farms and provide recommendations on limiting pollution. The FDA is in charge of testing and approving chemicals involved in agriculture. The USDA regulates the agricultural sector to ensure food safety and quality. The USDA was created by President Abraham Lincoln, and it was called the People's Department. It was to provide work, food, agriculture, and social and economic science and natural resources. This Venn diagram shows the interrelationship between the agencies and how they function together. Recommended policy changes to improve farm workers' health include including farm workers in the Occupational Safety and Health Administration, which is known as OSHA, work closer with the EPA for more strictly enforced standards, especially associated to pesticide use. In Maryland, the Pesticide and Chesapeake Bay Watershed Project is working towards banning organophosphates and providing personal protective equipment for farm workers, especially during the pandemic, as they are considered essential workers. So earlier in my presentation, I brought up regenerative agriculture. Regenerative agriculture focuses on restoring the soil and working with the natural ecological balance of the land. So this farmer, Gabe Brown, has been running his own regenerative farm for the past 20 years, and he found that he could limit his use of pesticides and herbicides, and he actually found a gain in his production. The scholarship of interdisciplinarity. I found throughout this project that environmental science and health science should work together to influence policy, and policy should be based on existing and continued research in environmental and health sciences. Moving forward, these changes in policies would result in a better environment, improved population health, and improvement for farm worker conditions. General Mills, who creates some of our most famous and favorite snacks, promised to transition to 1 million acres of regenerative agriculture by 2030. Thank you. That's the end.
Thank you very much, Samar. Well done. We have time for questions from anybody and everybody. Patricia, please.
Thank you. I thought that was very, very interesting. It makes me want to go down to my kitchen and maybe throw some things out. Couple things. I saw quickly a slide on there, but it didn't stay, that had the percentage of these glyphosates in it. And I think you started with apples and grapes and then it went away. I wonder if you can show that slide again. And the second question is, what if you buy organic?
So a lot of people do support organic farming. The only problem with that is it can be kind of elitist because not everybody can afford organic because it's more expensive and it might not be available to everybody. And there are some issues with getting verified as an organic farm because although you may be practicing organically, if a farm nearby isn't, like wind and erosion can also pollute your produce. It's kind of a tricky situation. This is the slide you were referring to. It got kind of mixed up in my presentation, but when I was referring to apples as an apple a day keeps the doctor away, apples are highly, I don't want to say toxic, but they do have a lot of toxic residue on them. And this is from USDA.
Thank you, Samar. And Patricia, is that the answer you're looking for?
Yes, I'm just looking. This is 2011. Hopefully it's better now.
Hopefully,
do you have any optimism that it is better?
I couldn't find anything more up to date, but there are a lot of people moving to more sustainable and regenerative agriculture. So hopefully these percentages would decrease.
Thank you.
Thank you. Samar, Josh Hecht asked you in chat whether you can confirm that farmers are certainly not part of OSHA. Is that true?
It's farm workers who aren't.
Farm workers.
No.
Thank you. Thank you. On a related note, could I ask you, do you have a source for relating glyphosate to nerve gas?
Yeah, I think it's cited in my slide.
Thank you.
But it's also my paper with the history of how organophosphates were created was to be used in World War II, and then they were eventually I want to say advertised, but I'm not sure if that's the right word, to be used in agriculture as a pesticide.
Thank you. And just to be clear, the reason I asked and didn't understand that it was one of those two is that neither of those two looks obviously, I guess it's the top one. Is it Bihar? That's the one where he explains the connection.
Yeah.
Thank you.
I think so, yeah.
Thank you very much.
No problem.
Any other questions?
Professor Brown has his hand raised.
Oh, thank you.
Yes, Samar, thank you for your presentation. I was wondering if you could go back to your Scholarship of Interdisciplinarity screen. It looked like you were we're going to make a full discussion about checks and balances. Could you, I'm assuming, yeah, that's what I see there.
Yeah.
Could you talk a little bit more about what's going on and how you see that working?
Yeah, I ran out of time, but one of the seminal works that I got a lot of research from was this book called Food Fix by Dr. Hyman. And I thought this was a great example of SOI because he's a doctor talking about how changes in agriculture can be used as medical interventions to promote health. And he also looks at the reason why our agricultural practices cause illness and disease. So I thought that's why policy should be influenced by existing science, because so far what I've learned is that the policy comes before the science is evaluated.
Okay, thank you.
Thank you very much. Now, we will stay around. Oh, I'm so sorry. I missed a hand raised and Holly has caught me. Catalina, would you like to ask a question? I do apologize for not seeing that.
Oh, no, it's totally fine. I was curious in the terms of policy, if you were able to, if you came across the idea of the supply and demand, right? Because so much of that drives the price of things. And so, like you said, it's very expensive to have clean food. But there's a huge demand, for example, from schools, which is a huge client for mass-produced food, and they're not as willing to change because of cost, right? So, and they also very influential lobbyists for policy. So were you able to come across as like, is there any movement there to combine the policy with the highest clients that would make a huge shift towards more sustainable and healthy food?
Well, thank you for your question. I found that in my research, industrial agriculture gets a lot of subsidies for the government, and that's why it's so cheap and easy to produce. So if we redirect those subsidies towards organic or regenerative farming, then it could be more affordable. And for a project I'm doing for another class about farm to school programs, we're working on having local farmers be the main supplier for food in their local school district. So that's also an option. But some limitations with that are the seasonality of their produce. Does that answer your question?
Yes, thank you.
Thank you very much. I'm scrolling up and down looking for other hands. Please do put stuff in chat if you want. Oh, is that an answer? Oh, there we are. Josh asked one more question to you, Samar, if I may. In regards to the regulatory issues, have you found any guidance for the industry from the FDA on agriculture toxicity profiles? and EPA environmental conditions. I feel like I didn't have punctuation in the right place. Josh, would you like to say that verbally?
Can you hear me okay?
Yep, thank you.
So what I'm asking is that the FDA has certain codes of federal regulation for both agriculture, for the development of food. They just as they do for biologics for the development of medicine, biological medicine. And the FDA will also have what are called industry guidelines that help industry professionals navigate the regulatory to produce large sums of their product. So for instance, I do know that under the CFR, I can't remember which CFR it is, that the agriculture industry does follow for pesticides, and they have to follow certain toxicity profiles in order for it to be not only safe for the consumer, but also safe for the environment. Similar to the EPA, they have similar regulatory that they have to follow that is in cohortion with the FDA. So I'm wondering if you were able to find any of that regulatory and how, whether or not you feel that needs to be changed, whether that's not good enough.
I haven't been able to dive that deeply into regulation, but I do remember learning that I think it was a list of 100 chemicals used in agriculture that were not approved by the FDA because they were already being used. So it was just kind of, they signed off and said it was okay. I can't remember the name of the list, but I'd be happy to find it and share it with you. I think that is where a lot of the issue comes from because it wasn't tested. And I think another issue with regulation regarding agriculture is that these pollutants can be like persistent pollutants, so their effects are not seen right away, but rather after them being used constantly over a long period of time. So I think that's where there would need to be more research and where the effort should be guided, and that should be included as a part of approving the chemicals.
Thank you,
My
Samar.
last question here is, in regards to your Capstone project, did you do any research into the scientific literature to see if anyone in the industry has done long-term effect studies to see how these chemicals impacted the environment and also impacted people, to see if in fact these were safe, whether they were not safe, or they could be safer?
Most of the stuff that I was focusing on was the consequences of these chemicals, not so much them by themselves. So I did find that, like with glyphosate, because we use it and have been using it, the nutritional quality of our food has significantly decreased because plants can't absorb the nutrients, and then that has lasting or impacts on like everything, childhood development into adulthood. And if you're lacking those essential nutrients, your body wouldn't function as best as it can or it should.
Thank you, Summer, and thank you, Josh. To keep a level playing field, we should probably end formal Q&A there. But I think along with everyone else, Summer would be more than happy to enter into further conversation with anybody who would like to talk to us. Thank you, Summer. Thank you all. I want to say a special thank you to our students for mastering all of the implied extras of online presentation and doing a wonderful job that makes us proud of you. You've adapted, and we think that's